So Dave was a pretty complex case. You know, he had a long road even before he got to us. He worked with not only myself, but occupational therapy, as well as in constant communications, not only with us, but with his doctors within our facility, but also his doctors at University of Iowa too. There were a lot of bumps in the road where he developed some different conditions that resulted in some hospital stays. So we were constantly kind of not only treating him personally, but having to dig ourselves kind of out of those holes every time he did end up back in the hospital. So I think the integration of care, you know, with us being centrally located in the hospital, we're able to always stay in contact with his doctors, his medical team, the nurses, you know, anytime he had any of those conditions come up.
Just that I could do it in my hometown, you know, that I didn't have to go so far to have the therapy really meant a lot. So it worked out real good that we could be here right here in Manning doing the therapy.
It's always good to be close to home.
Yeah.
I always tell people, you know, regardless of the condition, you know, we're going to see you anywhere from, you know, 1 to 3 days a week. But there's also, you know, those 6 to 4 days in between where we're not going to see you. So we're going to definitely give you homework to work on during that time. And it's really up to the patient. I mean, we're not going to overload someone. We're going to give you, you know, the core things that you need to work on. And then when you come in here, we're going to push you a little bit more. But that's kind of always what I tell people. And that shows even in Dave's circumstance. You know, he had the support at home as well as his own motivation to, you know, do those things that he needed to do to get better.
I couldn't walk very good, yeah, just even standing.
You're starting to grab things with the left hand.
Mm-hmm.
Otherwise, with that left hand, he couldn't do absolutely anything. Getting more self-sufficient.
Being able to come home, sit in my chair and watch television, I like that. I like going for rides in my truck.
With my wife driving.
Yeah, well, I mean, it would mean more if I could drive, but I can't. But it means a lot. Like on Sunday afternoon, go for a little drive.
Dave, he's improved quite a bit. I mean, like I said, he had some bumps in the road that we always had to dig ourselves out of, but he was a perfect candidate. He was super motivated. He had a good social support in order to kind of push him. And every time he came in, he was motivated to get better, and it shows on how much better he's doing compared to where he was.
Yeah, I don't think he'd be where he is if it wasn't for the help of his brothers.
Yeah.
They pushed him.
It was really good to see my brothers back. You know, that really meant something, that they would come home to help me.
Community and the church family, you know, worked together for him. The Knights of Columbus put on a pancake breakfast for him. So that was awesome.
Yeah, it was.
I think that's the biggest thing, is if someone has the right mindset, you're going to do well with our assistance, finding the right exercises that's going to get you to where you want to be goal-wise. But like I said, I mean, his mindset was perfect from the get-go.
It was really good between both of them, that we worked together, and they always talked about different things, what we did in the weekend and stuff like that. That it was really a homey feeling.
Very easy people to work with, and he gained a lot of strength. They're awesome.
Yeah.
If you're experiencing any joint or muscle pain, as well as any recovery from surgery, as well as stroke or brain injury, give us a call here at Manning Regional Healthcare Center, and we can help you achieve the goals that you want to get back to doing.
Manning Regional Healthcare Center, your trusted experts close to home.